So is everybody coming to the summit next week? It's very exciting. Next Friday, Saturday. 2 full days of polyvagal theory. Dory. Oh, Charlene's saying that she has. Oh, okay. Somebody checking her furnace, so she's off screen. We had 40 something people sign up, so we're just going to wait a few more minutes for people to come. Are people checking the group page often? You take a look and see who's joining, and people are joining pretty well every day. It's amazing. I think we have 616 people on the group page. It's like incredible, really. You think about it. That's a lot of people, right? And some really nice interaction happening, which is great.
One thing I've noticed is when we respond, if we say hi, so-and-so, and then put our response on the next line, you don't see the response in the email notifications.
Mm-hmm.
And so I would encourage people to not use proper punctuation in order for people to see a little bit about what's this conversation about. Because I often know, for me at least, when I see just like hi and I have no idea what it is, I'm not going to go look. But if it's hi, da da da, and I'm like, oh, curious.
Well, sometimes I see the conversation and sometimes I don't.
Yeah, I think it depends.
I don't know.
On how
maybe if I'm a
paragraph.
If what?
If you just write a paragraph, like if you don't hit enter after your greeting, if you just keep going,
Oh.
then it's in the email. Anyways.
Oh.
Small thing we can do. I would love if they changed it. But that.
I'm not asking right now. Everybody is obsessed with getting ready for the summit. But
yeah,
maybe
after the summit, we could maybe get some changes. But in the meantime, if people do that, it helps to have people know what's going on.
Yeah. Okay. Well, maybe we should start because it's 5 after. Maybe some people have signed up, but they're just going to listen to the recording. So, okay. So we have Andrea Trank is going to present today on HeartMath and relating it to polyvagal theory and to trauma and addiction. And Andrea's one of our group, and we're really encouraging people to come forward. So we have some new things happening in November, December, January, but please do, if you'd like to present, it doesn't have to be anything fancy, just a sharing. It would be great to have more people come in the winter. So Andrea, I'd like it if you introduce yourself, because you'll do a better job than I will. You know more about you than I do. And yeah, we're all excited to hear about what you're up to.
Okay, well, I guess I need to pin myself in order to see myself. Yeah, I don't know if it's important or not. Hi, everybody. I am Andrea Trank, and I'm going to introduce myself a few slides into the presentation, and you'll understand why when I do. So I'm going to share my screen and get right into my slideshow. Okay, views. Okay, oops, sorry. All right, so I want to start with these prompts. Undigested experiences start to eat away at our life force, our vitality, our capacity to respond to the moment, and then we start to perceive the present moment through undigested past experiences. Anybody want to comment on that prompt? Does it mean anything? And I may not be able to see the hand, so Jan or Annette, either one of you, if you see anybody with their hand up, or you can just go ahead and speak. If anybody wants to. What does this mean to you?
This is Shanti. I'll just give a quick hit of what this means. I mean, our whole perception of the world comes from everything that came before, and when our experiences are still rambling inside of us, or we've been re-triggered by events, it narrows our view to hyper focus on those things, even though the world may be more expansive. And it's really difficult to maintain that level of energy and resilience to connect with our deep life force, because it feels like there's a big blanket over us, or other things that are really heavy.
Shanti is a HeartMath practitioner as well. She and I know each other through HeartMath. And yes, Rachel, go ahead and you raised your hand. Go ahead and add something.
Hi, I just add something. So I've just had the experience of that, what it says in the last 12 hours. It's been so weird. I'm out of it now, but I was watching Made. You might know it. It's like
Yeah.
Netflix. And I've been late to the series, so I just watched the piece where she disappears in the sofa. If that means anything. And I was just blown out by it. I was totally, I knew I was, but it was bedtime, weird night's sleep, bilateral music, that was good. And it was only when I had a conversation with my mum, like about noon today, and I literally felt myself coming back. It was so, I didn't expect it to take me out. There's no point in having a trigger warning because you get triggered by what you're not expecting, you know, but poof, I was literally gone. And then poof, I came back. So
Wow.
you can think you've done, well, we all done some stuff, and we've all got some stuff.
Yes,
Poof.
and it's funny you
Oh.
bring up TV, Rachel, because we've been watching Downton Abbey. I know we're 10 years later than most people saw it. However, the amount of trauma that was undigested, you know, before people understood trauma and what it did. So of course, I'm watching every bit of it through a trauma lens, a polyvagal lens, through a HeartMath lens. You know, I wish I could analyze these people and take them and help them, but it's pretty amazing, you know, that we just didn't understand this. We didn't understand what it did to our nervous system and then how to get out of this. So shifting into a little bit more HeartMath, when you are stressed out, the heart beats out of rhythm. And I think somebody wants to make a comment on that one. The show called The Maid, Danica, that's what Rachel was talking about. And that's really like gone crazy on Netflix. And it is about some trauma. When you are stressed out, your heart beats out of rhythm. And maybe that just makes perfect sense to people. Maybe you sense that in yourself. When you are stressed out, if you pay attention to your heart, the rhythm of your heart is really kind of, it's not smooth. And then lastly, before we move into the presentation, the rhythms of our heart are most reflective of what we're feeling. The rhythms of our heart are most reflective of what we're feeling. Does anybody want to make a comment on that one?
And I wanted to say something with the past, you know, just that past frame, the past slide. Can you hear me?
I can.
Yeah, we're
Great.
good, Rob.
Great. Okay. So this undigested, you know, that's the term undigested. I have to think about it a bit, but I think what you're referring to here is how the past is never past. In other words, we have a whole body of implicit knowledge that forms right when we're an infant right through. And this knowledge is created through neurotransmitters that connect to our experiences. So when you have an experience, we have the neurotransmitters work to ensure that we either move towards that experience neutral or stay away from it. So in short, we have a lot of wisdom that's actually used for our decision making. However, some of that wisdom is a real problem. It's not valid wisdom. It's if you live in difficult families, you see things, etc. So in other words, our current reality is based on some past experience. And Causalino talks about the vital half second, the vital half second. So the difference between our unconscious processing and our conscious awareness is like a half second, but it's a lifetime in neural processing speed. And so if you mean by undigested past things, this, we get activated by an experience. For instance, you see a woman or a man, doesn't matter, who reminds you of somebody who, I'm not talking consciously, somebody who maybe was negative towards you. And you get triggered by that from a past experience. And it impacts your behavior and feelings in the present, even though you have no idea that that was residing in you and that was sitting in you, right? And so if that's what you mean sort of by undigested past experiences, where we have no awareness of it, and it was processed in a certain way, but it definitely affects our present behavior, then that's how I see all of that fitting in.
Well, and I think that's a beautiful lead in. Can I call you Robert, or would you?
Sure.
Okay, Robert. And I could go a lot further in this, but I just wanted to open the door to lead into my HeartMath discussion. I want to go further with you on this, but I want to explain what HeartMath is about first. And then this comes up again when we talk about our amygdala and the heart communication system, and why getting into coherence becomes so important for maybe activating a different pathway, and the importance of vagal tone and the window of tolerance. So this is such a huge discussion, and I'm hoping that you'll come back and speak soon.
Well,
So
I'm working on Rob joining me next time. So
Good.
we're working on it.
Oh, good, because I would just like to give the floor over to you and get into all this discussion as well. So thank you.
No, don't do that now. This is your
Okay.
turn, Andrea. Yeah.
All right, so let's move on. Okay, so I'm a school teacher by trade, so of course I have to have a program outline. I'm going to explain quickly what the HeartMath system is. I'm going to give you a little bit about me, and that's when you actually learn, why am I doing this? What am I doing? My history and how I discovered HeartMath. Then we're going to do a tool together, one of the HeartMath tools together. Then I'm going to talk about how HeartMath is and can be used in both, and I should have had co-regulation and self-regulation in educational settings with people with trauma, and therapeutic settings for people with trauma and addiction. And then we'll do another tool together. And I'm sure some of you will be fascinated by our biofeedback technology, which I have hooked in my ear the whole time to see how coherent I am as we're going through this. Okay. So the HeartMath system, believe it or not, is about 30 years old. It's used in hospitals, health professionals, businesses, police, fire, corrections, in other words, in jails, in schools, K through 12, in universities, in nonprofits. Professional athletes have been using it, Olympic teams, and the military and the special forces. My particular interest is in K through 12 education and in university. So that's where, because I was a former school teacher, they have 400 published research studies, 300 they've done themselves, at least another 100 being done outside of the organization by independent people who bring up HeartMath in it. And so this is, oh, I'm gonna have to keep my dogs quiet. Hey, sorry. All right. I've got two of them. So it's the two big terms that we use a lot in HeartMath are heart rate variability and coherence, and the physiology of coherence. So this picture is a great picture if you're talking about coherence, because it is about syncing. And when we talk about coherence in HeartMath, we're talking about the optimal state in which your heart, your mind, and your emotions are aligned and in sync. And that means physiologically, it's your immune system, your hormonal system, and your nervous system are all functioning in a state of energetic coordination. So unfortunately, when we're trained in HeartMath, we look at the nervous system this way. We don't get down into the dorsal vagal system, although more and more HeartMath practitioners and the HeartMath institution are very aware that they've left off a part of this, the dorsal vagal system, but they're very involved in understanding how this affects our nervous system. And that's, I'm not going to go through this. This is just to show you, this is a slide that we're shown, and I think they're going to need to update this soon because they have gotten more and more involved in the polyvagal theories of Dr. Porges.
Mm-hmm.
But the big thing that HeartMath focuses on is the heart-brain communication. And the whole idea that the heart has its own complex nervous system and that the communication through the vagus nerve from the heart to the brain is far more than the communication that comes down from the brain to the heart. And that these patterns affect the brain centers that are involved in perception, emotional experience, and self-regulation. So here's where a lot of people get really confused. So we look at heart rate variability through much of our HeartMath work. And most people, when they would look at a graph like this, without these numbers in between, might just think that our heart rate is all the same, right? Beats per minute. That's what we're told. My heart rate is 70 beats per minute, 60 beats per minute. Well, in fact, that's the average. And if you actually looked at it, so this person's heart rate could be averaged out to 76 beats per minute. But the variability goes from 70 beats per minute to 83 beats per minute, all in 2.5 seconds of time. So our heart is not beating at this regular pace. And in fact, we've determined that the more irregular, but smoothly irregular it's beating could be an indication of good health, of your system working really well together. So that's something a lot of people get confused about. And if there is any confusion on that before I keep going, if somebody needs to ask a question, please feel free to, because boy, this took me a while to figure out. Anybody? Okay, I'll go on then. All right, so when they take this pattern at the bottom, which is your heartbeats, and the space between there, and they plot it up here, it does make a shape. And what they have determined in HeartMath and in many other studies is the smoother this is able to go up and down like this, the more coherent your system is in. So another word, and I'll show you on the next slide. So look at this is a pattern of heart rate variability on the left that's in red. This is what we would call an incoherent pattern. And what they have determined through a lot of their studies is your variability is in this kind of earthquake line, jagged pattern when you are feeling the emotions of frustration, irritation, impatience, worry, anger, all the things that they would call depleting emotions. Then they look at somebody who is feeling appreciation, calm, patience, confidence, joy, happiness, love, and look what happens to the heart rate variability. It smooths out and it looks like these beautiful waves. And then look down here. These patterns are cortical inhibition patterns, which means it inhibits our higher level thinking. And these over here are facilitative of higher level thinking, better decision making, work performance, being more social, being in that state of safe and social. So anybody want to stop me now before I go on? I don't want to just talk through this if somebody's got a burning question. So interrupt me anytime you need to. All right. So they've done all these studies on this heart to brain communication, and the heart rhythms are directly affecting the brain centers involved in foresight, decision-making, social awareness, and the ability to self-regulate. So you can see those last two would very much start to intersect with the polyvagal theory, with the ventral vagus system and safe and social.
I just had a quick question.
Yes.
And I'll make it real quick because I don't want to, on your previous graph, you know, you had the two scenarios. Yeah, on the graph on the left, which is incoherence, does this reflect mobilization? You know how with polyvagal, does this reflect mobilization? Like, you know, because that's where you're into a defensive kind of scenario, etc. Would it, or would something in immobilization or the dorsal vagal, would the graph look different instead of frustration, irritation, impatience, worry, let's say disconnect, depression,
Yeah.
you know, that kind of thing?
Yes, we do have graphs, and actually Dr. Roland McCready is the lead researcher. He's actually graphed different, like frustration looks slightly different than irritation, looks slightly different than impatience, looks different than anxiety, looks different than depression, looks different than, so they're all slightly different, but they're all in, and he's got a dozen of these. Yes.
I think
So-
what it speaks to though is that this is the older traditional model of the ANS, and it doesn't really reflect or incorporate the dorsal vagus.
Yep.
And it probably doesn't because they're looking from heart to brain, but I still feel like, and in dorsal vagal, if the emotion is boredom, lackluster, they're all considered depleting emotions according to the HeartMath system. And these depleting emotions, if we can shift them from a depleting side to uplifting, or and I know I'm spacing out on the term. So Shanti, what's the other term that we use instead of uplifting? Depleting to renewing emotions. And so, but I do appreciate, you know, a lot of this research was done years ago, and I think they're probably going to incorporate and look at more. And hey, that's an area of research for you guys. Waylon, did you want to say something? I saw Waylon popping in, or they were, okay. All right.
I could say something.
Okay.
I've been doing, you know, HeartMath using the inner balance version for years, probably 3 or 4 years now. And yep, I got it going right now too. And what I think I would say is that when we're in sort of a ventral vagal place, then we're going to be in a state of coherence. And when we're not, whether it's fight, flight, freeze, or shut down, it's going to reflect the incoherent graph.
And I would definitely agree with you, because, you know, the part that I first got confused about is because this is not a relaxation technique. So it's not like we're in parasympathetic all the time, but we're in a state where we only get into sympathetic when we need it, and we can smoothly move in and out of it from parasympathetic to sympathetic. And so I guess, and my understanding, and I'm pretty new to polyvagal theory, is according to Dr. Porges, that would still be in a pretty regulated ventral vagal state, right? You're still activating your sympathetic when your body demands those things, right? When you need to move, when you need to think, and then, but just very quickly, you can go back into your parasympathetic when you need to eat, when you need to sleep, when you need other processes. Is that what, you know?
Well, the dorsal part of the vagus is when the system is not able to manage in sympathetic. You know, these studies came from premature babies. And what they were expecting was that these babies who were really ill would be in sympathetic. Their heart rates would go up when they were ill. And what they found was that the heart rates actually dropped because the system was shutting down. And so it's a very different state.
Okay, but is it fair to say that you could still be, if you're in a coherent state, that according to this theory, you would be in a ventral vagal state, because still within
coherence is definitely ventral vagus. And what's interesting too, Andrea, is that, you know, Steve's blended states. So you can also be in the state he calls stillness, or I call flow, in the 6Fs, where there's a dorsal presence, but there's also a ventral presence. So you're still, but you're safe. You're immobilized in dorsal, but there is this ventral presence.
And that's more intimacy, correct?
Yeah, yeah. And that's probably a big part of this too, right? Is it? Yeah.
I would also think that the states of flow and fun on your chart, Jan, would both be in a state of coherence. But I notice even when I go to sleep, I get out of a state of coherence. Like right now, I can look on my HeartMath monitor or my biofeedback monitor and see that every time I speak, and this just isn't true here, I've noticed this over the years. Every time I go to speak, even in a therapy session or where I'm the client, not the therapist, I will still get out of a state of coherence just by talking. So I'm sure some people could talk and stay in a state of coherence.
Well, yeah, I can, because I love to teach. And I once looked down at my monitor in the middle of me teaching, and I went up to 9 in a state of coherence. And I've never done that in my life again or before. I looked down and I went, what? And I was just so happy talking. And then I started understanding from Dr. Porges's, theory that, okay, so I'm smiling and it's, up here near my eyes, right? And so I'm activating my safe and social. I really love to talk. And I guess that puts me in coherence, in a state.
Well, that would be a blended state of what I call fun, but I'm also thinking of adding fired up to that. So you've got this blend of ventral and sympathetic.
That's cool. I think that would probably be me.
Okay. Yeah, sure.
All right. So in the HeartMath research, these are some of the results they've had in their studies, that they've studied and had success with people enhancing their ability to maintain composure during challenges, family and social harmony, reducing fatigue, promoting the body's natural regenerative, improving coordination and reaction times. That's a really interesting one. A lot of athletes love this system. Think clear. And in the school system, they've done a lot of studies on giving this, teaching the kids these techniques and tools before they take tests. And the last one, I don't have time to get into today, but it's some of the most fascinating research on the increasing the access to intuitive intelligence. And they have really done some fascinating research on it, but it's a little bit out of our topics, so I'm not going to go into that.
Can I say something quickly, just on your screen?
Yeah.
All of those, there's empirical evidence for all of those things for mindfulness practice over time. Mindfulness practice correlates with, looks like every single one of these things.
Yeah,
and that is so true, because there is part of this as a mindfulness practice. And Robert, I'm going to get into the biggest difference between our practice and meditation in a couple of slides. Okay, so, and this I'm not going to spend a lot of time on, because I think a lot of you coming from your training understand this, that repeated thoughts, emotions, attitudes, and behaviors create internal baselines, which becomes your automatic response patterns that are both familiar and predictable. And I think this particularly ties into addiction and I've been reading Jan's book in the past couple of weeks as I've been getting ready for this, and it just has so many amazing things. And HeartMath has also done some studies with addictive behaviors. In fact, one of their main people, Shiva Kar, is very involved with sex trafficking, and the studies she has done shows that many people who are abused as children are part of that group that becomes sex trafficked because of the familiar and predictable, and in some ways their nervous system, you know, even it's adapted and it feels safe in this place. But, you know, that's just, again, another huge, huge topic. But what HeartMath can do through its coherence training is hopefully establish a new normal, hopefully expand the window of tolerance for people who've had trauma. And then hopefully your nervous system begins to recognize this more resilient and energy efficient state as the familiar one. So then it becomes your new internal set point and it becomes more automatic. I see a lot of comments. Is there anything I should address? Doesn't look like anything. Okay. All right. So moving on. So, and this is interesting because Jan asks this a lot in her book, like take a pause. How do you feel right now with this conversation? How do you feel in your heart, in your brain, in your nervous system? You know, when we are you getting out of sync even in this conversation? Is there something about this that's triggering? And I did that a lot during Jan's book, you know, as she was bringing things up, she asked us to pause. So I'm just asking you to pause for a minute and just tap into.
This is so important, Andrea, to really bring that awareness of our body right now into what we're talking about. Yeah, beautiful.
So me, why am I doing this? What is about me? Okay, the picture all the way to the left is I was a school teacher. I look like a baby in that picture, especially on the ID. I was a school teacher for about 20, 25 years. And I poured my heart into my students. I was a Golden Apple Award winner. I was just the teacher that was there. Every lunch break I spent in my classroom so the kids had a safe place to be. I ran after school clubs. I ran the journalism program. And I got sick every summer. Every summer I got sick. Like I just didn't know what was wrong with me. I just completely collapsed. And eventually this led to autoimmune disease. And I now, through the HeartMath work and now understanding the Polyvagal Theory, it's like, I wasn't self-regulating, and I was probably giving, but I wasn't taking care of myself completely and my nervous system. And I wasn't digesting all of the traumas that the kids were going through and everything I witnessed. I mean, I was a teacher during 9/11 and having to help the kids get through that. So I left the high school and the college classroom. I ended my career as a college adjunct professor in the College of Education, and I went back and became a yoga teacher. I thought, if I'm going to teach, I might as well teach something that's really good for me. And so I started teaching yoga, and then it was just about the beginning of COVID-19 that I discovered the HeartMath system. In between, I also became an integrative medicine health coach. I was trying to heal myself. And I just was grabbing at anything and really trying all these practices. And they were all helping, but I still wasn't nervous system regulated. And I still didn't know why. And so the HeartMath system really worked for me. And so this is a recent picture of me doing some of my HeartMath practices. All right, so we're going to all do a practice together. This is a very short, simple, easy practice, but this is what makes HeartMath such a wonderful tool. It is a tool that can be used on the go. So I don't have to spend 25 minutes in the morning meditating and 25 minutes at night, because a lot of people, number one, they're not ready to do that. Number two, don't feel like they have time. And number three, if your system is already kind of dysregulated, particularly toward the anxiety side of things, then sitting down for 20 minutes may not work for you. One of the other things that I do a lot is gentle somatic yoga. So I've incorporated a lot of movement into my healing and to helping my students and clients heal. So please join me if you feel safe to do so. If you don't want to, you can just watch and listen. And this is sort of the basis of most of HeartMath's practices. And it's called heart-focused breathing. It is a very powerful tool for self-regulation. And the reason is because you are focusing your attention and therefore your breath in your heart center. Often in yoga and in a lot of other tools we do these really deep breaths where we focus on deep diaphragmatic breathing and all sorts of others, but this is focused on the heart. Does somebody want to ask a question before we do that? Was it Robert or somebody? Okay, all right. It is step one in shifting to a more coherent state. And what is really interesting is this is an alert and calm state. It is not a meditative state. It's alert and calm. All right. Focus, if you don't mind joining me. Focus your attention in the area of the heart. Some people like to put their hand there, but it's not necessary. Your eyes can be opened or they can be closed. This is up to you. Imagine your breath is flowing in and out of your heart or chest area, a little slower and a little deeper than usual. For many people, 5 seconds in and 5 seconds out is optimal, but it's up to you. Just try to keep it flowing. Don't pause at the top. Don't pause at the bottom of your breath. And once again, just sense if there's any shift. Is there any shift anywhere that you can sense inside your body? So that is 45 seconds maybe or less. And even in a practice that short, at a stoplight, right? Or in the middle of your day or between your clients, it's a recentering. But when I have my inner balance on, as I was doing that, I immediately went into green, which means that I was syncing up my heart, my brain, my nervous system, my hormonal system, and my respiratory system. They've done lots of studies on blood pressure and some other things. And I will get into the hormones that are released in just a minute. So what is interesting for this is HeartMath techniques are not necessarily about meditating or getting into a total relaxation, because sometimes if you ask somebody who's had trauma to get into a relaxation, it's actually triggering for them because their nervous system, there wants to be on alert. And it's not until they feel safe and social. So these tools are really gentle ways of just shifting your situational awareness for direct perception in the moment to balance the nervous system. And Shiva Kar talked about a friend of hers that she went to school with, that every time they would do a fire drill what would happen to her, I guess she was in Vietnam when the air raids were going on. She did not know what to do in a fire drill, that all the other kids wanted to go outside. She would dive under a desk and just, cover her ears because she was not in that moment. And that the HeartMath tools that they worked on with her helped her just develop that this was about this moment. This is a fire drill in a school in, I'm not sure if it was Boulder, Colorado. This is not Vietnam in your childhood. And so it was not even about explaining or talking through the difference. It was just opening up this coherence so that she was able to be more perceptive about what was going on right then and there. So I'm going to go through that again. HeartMath is not a relaxation technique. And I'm going to talk a little bit about the amygdala here. It's less threatening to a hypervigilant person than relaxation techniques. So this is really, it's a soothing technique, but it's not about getting yourself completely into a parasympathetic state, which maybe some people are not ready for. It can ease someone out of a pattern of hypervigilance. So again, your heart signals are monitored by the amygdala, which determines what is familiar and not familiar. And what we are doing is trying to create this to be the new familiar instead of this one. This may have been the familiar. So I want to go into this a little bit. So since the amygdala identifies what's familiar as safe and comfortable, if you were living in an unsafe environment, particularly during childhood, that might become the familiar, even if it's not optimal. And so people who have used the HeartMath system with people who developmentally have had trauma and their safe is not optimal for what's going on. And I think, Jan, you call it was helpful and hurting at the same time, right?
Mm-hmm. Yes. Well,
So,
yeah, that is the state of addiction too, right? It helps you and it hurts you.
exactly. So this, your book just was so amazing for me to be reading about this at the same time of trying to put together how HeartMath, plays into this. So the HeartMath system, if they start to learn some self-regulation skills, the heart rhythm patterns become coherent. That sends signals up to the vagus nerve, to the brain, saying, we don't need to return to what the amygdala, the emotional memory is. It will allow the cortex, the higher functioning part of your brain, to come online. Instead of normally it would go to your amygdala, your emotional memory. Does that make sense? I know I'm saying it in a simple way and probably not good enough for a neuroscientist in our audience.
Do you want to say something, Rob? No, he's good.
Okay.
It makes sense. In polyvagal terms, we would say that when the ventral part of the vagus is activated, then, the prefrontal cortex is clear and online and you can think well and you can focus. Yeah, which just makes sense in terms of how we experience life, right? When we're upset or we're numbing out, we don't think clearly.
Mm-hmm. Exactly. So, and I wrote down, we can look at our present trigger through our higher thinking part of the brain. It opens us to the access to the self and situational awareness so that you can have direct perception of what's actually going on instead of your emotional memory of what's going on. So it's tuning our system up so that we can feel connection again. And these simple interventions can be done with others and on your own as practice. And I love the way Shiva Carr says this. She says it's part of the hope and the promise of HeartMath. So she's somebody, I took her, I've taken quite a few courses with her, and she's very inspiring what she does. All right, so this is how I'm kind of using it, or helping teachers use it in one way in the educational setting. Most of us teachers were trained in a very behaviorist way of handling misbehaviors. Why? A kid misbehaves, you try to reason with them a little bit, and if they're not behaving, you send them out of the room, right? Because they're disrupting the whole class, or they're oppositional behavior. They don't want to learn. They're not interested, and you come up with all these things. Well, I never felt this way in a classroom, which is why I never had students written up. But I didn't have access to all these skills either. So I struggled with how to reach these kids, and using the polyvagal lens, and having just finished Dr. Porges's course this week, I was like, oh, they can't hear my voice. They can't even hear me speaking to them when they're so dysregulated. They're not hearing voices anymore. So I could be saying their name a dozen times and giving them instructions, and they're hearing a low hum of an air conditioner, right? Does that make sense to you all? Mm-hmm. And so with an understanding of that, and then with these HeartMath tools, which can be applied so simply in the classroom, this would be another way of both understanding and changing behaviors. So de-escalating situations by helping the children understand the state of their nervous system, and then using the biofeedback tools. And then HeartMath has a social emotional learning program. And then creating safer and social environments. And this is a big one, monitoring our own nervous system to see if we're getting dysregulated, because if we get into an incoherent state, then we are no longer able to create a coherent environment, a coherent classroom for the students. And so they have all sorts of cute things that they use in the classroom. I'm just gonna share these quickly. I love this one. Drama causes energy drain. And this is from their program, Smart Brain, Wise Heart. This is the drama meters. And look at this one. I'm a drama monster. Help, I can't stop thinking about this stuff. Oh no, you will not believe what I heard this person do, right? This person can't help themselves. They get back into drama. So they use a lot of really cute ways to help kids get back online. And then I'm working a lot with pre-service teachers to help them understand their own nervous system before they get full-time into the classroom.
Andrea, Mona Delahook's work, right? She wrote a book called Beyond Behavior. She's really integrated polyvagal theory into education. And she's presenting at the summit as well. And you'd love her work, I'm sure. It's similar, except she's really brought in the dorsal branch as well.
Oh, that is a part that I will be and I'm signed up, so I can't wait to see that.
And she's fun too, Mona. So her work is very similar, except she's really brought in the dorsal, which is so important, because when kids are shut down, they get looked over, right? Oh, they're no problem. They're not a behavior problem. Right. They're just failing, but they're not causing any problems. So who cares?
And in fact, I would say in my first year of teaching, I had a young woman, I was teaching 9th graders science. She committed suicide, and she was totally shut down before. And I have a feeling, if I had understood a little bit, I'm not blaming myself. Boy, did that affect me for a long time. Like, could I have done more to, notice what was going on? Mm-hmm. So they're actually using this also for theoretical special needs children. And this is really a cool application, that they hook up one of these monitors to the children as a teacher is working with someone with dyslexia. And if the child gets into a red state, an incoherent state, maybe through through a visual learning, then they'll know, well, visual learning doesn't work that well for this student. But like they want to hear instructions. Oh, this is an auditory learner. So it's helping them also figure out, based upon their coherence, if a learning method works better for students. And I could see that being used for all students, but particularly for students who've been identified as special ed. So that's pretty cool too, because students get frustrated because teachers often teach to the style that they learn best in. And so, as teachers, to be able to have a tool to really understand the child's best learning style through how they are reacting physiologically to the teaching is really interesting. And then this is just really interesting. There was a study that they did, several studies that talked about if you can get a few people to become coherent and another person comes into the classroom and has no idea that they've been practicing coherence skills, that within a couple of minutes, this person's heart rate variability will go from looking like that to this, so that our magnetic field of our coherence, and this to me is social, right? This is like the perfect example of safe and social, that we can.
This is co-regulation.
This is co-regulation, like, wow,
Yeah.
and they've hooked people up to monitors, and it's pretty amazing what happens.
Yeah, it's a really nice visual of it.
Yeah. So in therapeutic settings, the biofeedback tools in particular are really helpful before, during, and after sessions to monitor state changes. And so you can do a baseline with somebody, and then they were talking about if somebody, you're working with somebody with addiction. So you do the baseline, and this was Dr. Myron Thurber, and he is a doctor who uses a lot of HeartMath with addicts. He said if the addict, and then you bring up the whatever the addiction is, and you notice that they're going from green, being in a coherent state, to totally out of coherence, then that might indicate there's a lot of blame and shame and guilt. And so on the other hand, he said some people who are either former or current addicts, they actually get more coherent when they start thinking about, speaking about their addiction, because it is safe. That was a safe place for them. And so, that can really help a practitioner decide which direction to go in how they are trying to help somebody. Does that make sense?
I'd have to really think about it a bit more.
Okay.
Yeah, in terms of polyvagal theory.
Okay, I would love to hear.
Yeah, because coherence and ventral aren't quite, I'm not sure. We'd have to really get into that a little bit more. It's interesting.
I think there's a study. We got to get some funding for.
Yeah.
So HeartMath system has like more than a dozen different techniques that they use, all starting with that heart-focused breathing. But these can be taught to the clients to practice between sessions for self-regulation. And then, you can come back and just see, and then practice in your sessions to see how it does change their window of tolerance, and in terms of the other techniques that you would use for either people with trauma or people with addiction. And there are techniques for every situation: negative attitudes, triggers, communication issues. That's a big use. Solving intractable problems, developing more compassionate latitude. Lots of different tools. So in conclusion, I would say it's an adjunct in treating addiction. And we use the depletion to renewal grid. And this is where we get into the hormones. I do want to show you this one. And at the very beginning, when Robert was bringing up, and you, Jan, that we consider depleting emotions up in the top left-hand corner as they're depleting, but they're sympathetically activated. So they're kind of high energy depleting emotions, and you still release cortisol. Down here, and I'm not sure if this is true, but if you were in theoretically the dorsal vagal system, boredom, shut down, there still might be the release of cortisol here, and you're still on the left side. We're trying to get people over to the right side. In either case, you are going to release DHEA and oxytocin, which are happy hormones. So hormonally, if you move from the left side to the right side, you are going to be changing your system. And what we would do is we would call these emotions down here calm, serene, peaceful. Up here might be exuberant, joyful, excited. So, but they're still on the right side. Does that make sense? So we do use this grid a lot when we're working with individuals. And I think, gosh, we're out of time. I wanted to do the breathing technique. So that I did with you, this would be the follow-up breathing technique, but we can share this as part of the slideshow, but it is 1:59 according to I think because I allowed people to talk during the whole thing.
That's okay. That's
that all
fine.
right?
That's
Okay.
been great. It's been wonderful.
I'm going to stop the share and go to the gallery view.
We can go a few minutes of people. If you've got your hour and that's all you can stay, of course, feel free to leave. And if you'd like to stay another 10 minutes or so, we can stay 10 minutes. Anybody want to?
A lot to think about, huh, Robert?
Yes, yeah. And you know, the thing that came across to me was I'm always looking at the issue of mindfulness meditation and, you know, and this system as well. And I think it's a mistake to think about mindfulness meditation as relaxation. That was never the intent of it. For instance, one of the two big processes in mindfulness meditation is what we call open monitoring. Now that's just where you're sitting back. I talked to Jan about this the other day.
Yeah.
That's where you're sitting back and you're filtering things with a mental filter, with the acronym COAL: curiosity, openness, acceptance, loving kindness, right? So things come out, you filter it, things come in, go out, you don't push, you don't pull. So you're in that kind of a state. And so you're going to get some negative experience, some toxic thoughts, experiences, or whatever, that's going to start to activate you to some extent. But when you're in that kind of a state, it allows you to maintain sort of more equanimity, if I want to call it that, balance. And so what happens with the memory is that memory is porous. And so when you're in when you're in the equanimity, if I want to call it that, the toxic stuff comes in, and when it's mixed with that state, it detoxifies somewhat. The experience, the memory goes away to be reconsolidated. When that happens a few times, you learn to sit with. You learn to be able to sit with your experiences, your emotions, without getting aroused. Right?
And Robert, I am so with you on that. And really, you know, when I discovered HeartMath, it was more to reach the people that if the minute you say the word mindfulness meditation, they've already turned off. Right. And when you talk about, and I talk about curiosity, compassion, and I always say to everybody is, you know, you're kind of like you're a grandmother and a scientist to yourself at all times. You know, you wear your curious hat of a scientist and you wear that compassionate hat of a grandmother. And and you observe, but there's something about when we bring up that word meditation to some of the general public, particularly educators. I don't know if you've ever worked with educators, but school teachers, if I talk meditation to them, or even mindfulness, they'd say, if I'm mindful, I'm not going to see what's going on with these kids. And so I've had to use different language with them because they're so seeped in a completely different culture that they think of. Anytime you say mindfulness or meditation, they wouldn't even let me in the doorway until I said, this is a scientific system of getting in a coherent state.
Yeah. Yeah, it sort of technologizes those issues connected with the word meditation.
Yes, it does.
Well, whatever way we can get our message across, right?
Yeah, I was also thinking about that shifting the breathing focus from the stomach to the chest can be, I can see how that could be really helpful if someone carries a lot of their emotions and their sensations in their stomach. So if they're doing mindfulness that encourages you to do deep diaphragm breathing, that could be overwhelming. Whereas if you're breathing into the chest and that's not where you carry stuff, then that can really help someone be grounded when other strategies aren't working.
And
I'm definitely putting that one in my pocket.
ironically,
Sure.
Samantha, that we were trained in our HeartMath trauma sensitive class that some people don't want to focus on their heart. And if they don't want to focus on their heart initially, you get them to focus on their fingers, you get them to focus on anywhere you can.
Or you use focusing and you go into the body and the body decides, you don't decide.
Good idea. That's a good
Right?
idea.
The body decides where it feels safe to settle.
Yeah, that's
Yeah,
so true.
this is the power of focusing. It's like, it's not up to us to decide.
Yeah.
It's that person's body that knows, right? Yeah. I think it's fascinating, but I do think that without the articulation of the dorsal vagus, it leaves me a little uncomfortable. That's how I feel about it, especially when you're working with addiction, because in the state of addiction, people live in dorsal a lot. So how would you know without, without Steve's work of really articulating that dorsal branch of the vagus and seeing how does that integrate into this? Somebody's got to do that. You have to do that, Andrea.
I'm going to have your help with this, Jen.
Well, we can get it. We can pass it by Steve maybe after the summit. Okay, so I think we should wrap. That was beautiful. Next month, we'll make a date. I'm going to talk to Rob about coming with me to be with all of us and to reflect on the summit. And if you're not able to come, then you'll get a little taste of it when we're all together. And if you do come, then we can really sort of, if there are things that you want to talk about some more, things you got excited about, or they don't make any sense to you or whatever, we'll have an hour to be able to share. And then we've got a couple more coming up that we'll post on the top of the group page for December, January. I'm going to do December on the trauma of addiction at night at 7:30. So we're trying to spread out the times so that different time zones we can all be together. My colleague Leslie Ellis is going to do one in January, I think in the afternoon on a Sunday, on working with nightmares with focusing oriented therapy. And she's developed a really powerful, and also actually using the Felt Sense Polyvagal model. But anybody else want to share and come February, March, be great to hear from all of us. Okay, thank you, Andrea. That was amazing.
Thank you.
Thank you so much. That was really great. Okay, thanks everybody for coming. And hopefully see you next Friday.